It's really important for moms to realize that we're not making this recommendation lightly. We really believe that there's substantial risk to pregnant women.
I probably would not let them leave the exam room until I had them saying, yes, I will get the vaccine. That's how important I think it is.
Novel H1N1 is a new influenza virus that causes illness. Since its appearance this spring, it has spread worldwide. H1N1 is spreading in Nebraska as well. Pregnant moms and children younger than 5 are at special risk of serious complications of H1N1. They are also more likely to be hospitalized from it.
I think the most important thing for pregnant moms to realize is that this virus has disproportionately hit young people, and it's disproportionately hit pregnant women.
This novel virus, or new virus, was first found in April of this year.
Put your hand right there.
And the unique thing about this is it has a predilection for the younger age group. That would include the age of pregnancy.
And the study that was published recently showed that women who were pregnant wound up in the hospital a lot more and had a higher death rate.
According to the Center for Disease Control, a large number of deaths among pregnant women occurred during the flu pandemics of 1917 and 1918, and also in 1957 and 1958. Then as now, deaths of pregnant women, as well as adverse pregnancy outcomes, are associated with the new influenza virus. These include increased rates of spontaneous miscarriage and preterm birth. Delivery complications can also occur. Many pregnant women infected with the H1N1 influenza may go on to have a typical course of the flu. For others, the illness might produce serious complications. The H1N1 virus might be joined by secondary bacterial infections, such as pneumonia. And if a high fever occurs during the first trimester of pregnancy, it doubles the risk of neural tube defects, including spinal bifida. High fevers may be associated with other birth defects as well.
Everybody seems to have that hit by a truck feeling, sudden fever, chills, being fatigued, and then they start to get maybe a dry cough, a sore throat, maybe some nasal congestion and some upper respiratory symptoms. The virus lives in your secretions, so any way that you get your secretions out is how you spread it. So coughing and sneezing are the biggest reasons why. It falls onto surfaces, people touch those surfaces, and then they touch their eyes, nose, and mouth. So the best way people can avoid getting sick from any bug is to not touch their eyes, nose, and mouth without having just washed their hands.
If someone thinks that they've been exposed, you want something that works right away, and that's the Tamiflu. A vaccine takes 7 to 10 days before you start developing antibodies.
Pregnant women with flu symptoms need to be treated within 2 days with Tamiflu. They also need to follow up with the H1N1 vaccine.
We know that early treatment is the key, and so everybody in the high-risk category, which includes pregnant women, we want them to be treated as soon as possible to avoid the bad complications that can come about. If a mom should get H1N1, then she's going to have to do what she can to protect giving it to her child.
You can protect your child from infection by pumping your breast milk and letting someone else feed your baby.
Pump the breast milk, keep the baby and mom separated, but the milk should still go to the infant. And the mother's milk has high levels of antibodies, so the baby is actually receiving free immunity from the mother's past experiences.
Why don't you come right on in and have a seat?
The best thing that pregnant moms can do is to get the vaccine before they get sick.
I would say highly recommended, strongly recommended, a no-brainer. You can't emphasize enough the importance of this vaccine. And again, any infection to the mother will also affect the fetus. So for no other reason to get the vaccine is to protect the fetus.
If you had a cat or a dog, you might think about getting them vaccinated, to prevent diseases. So, well, why aren't you worth the same amount? You're worth getting vaccinated too.
Take the vaccine. What matters most is you.
Know what to do about the flu. For more information, visit dhhs.ne.gov.